History taking in a nephrotic syndrome patient. So basically, patients who are suspected to have nephrotic syndrome usually presents with facial puffiness and ankle swelling, and as a result, they can also have frothy urine. So when it comes to taking the history of presenting complaint in a nephrotic syndrome patient, firstly we have to evaluate the main presenting complaint, that is the facial puffiness or the edema. So we have to ask about the onset, the progression, which areas of the body it was affected initially, whether it had a diurnal variation worsening at night, and what are the exacerbating factors and what are the relieving factors. And afterwards, if the patient complains of frothy urine, we have to ask since when the frothy urine started and then about the progression of frothy urine. So, with these principal complaints, we can come into various differential diagnoses. First one, for facial puffiness and lower limb edema, we can come. The differential diagnoses are congenital heart failure, such as. So for that, we can just exclude. We can ask whether the patient had orthopnea, paroxysmal nocturnal dyspnea, or ankle swelling. And then the other differential is nephritic syndrome. So for that, we can ask whether the patient had red color urine, whether he had headache, blurring of vision, or increased blood pressure if the blood pressure was measured any time back in the day. And also liver disease is another differential diagnosis. We can ask whether the patient had elevated discoloration of skin and sclera and excessive itching. And the fourth DD is the history of allergen exposure. If and Also we can ask whether the patient is a known patient for chronic renal failure, and also we can ask whether he had features of anemia such as lethargy, weakness, fatigue as well. So once we narrow down our differential diagnosis, then we have to come in to look for the etiological causes for nephrotic syndrome. So when it comes to nephrotic syndrome, there's primary nephrotic syndrome, which is a minimal change nephrotic syndrome, and the secondary nephrotic syndrome. That is nephrotic syndrome happening secondary to other causes. So we want to determine whether this is a primary nephrotic syndrome or a secondary nephrotic syndrome. So with regards to the whether to find out whether it's a secondary nephrotic syndrome, we can ask for whether the patient had features suggestive of SLE, such as oral ulcers, alopecia, joint pain, and rashes. And whether the nephrotic syndrome is secondary to HSP, we can ask whether there's reduced urine output, whether there's red color urine, and whether there are any rashes in the buttock or anywhere in the skin. And afterwards, once we identify the etiological causes, then we have to check for the complications. So mainly most of the nephrotic patients have three main complications, one being hypovolemia, second being spontaneous bacterial peritonitis, and the third being thrombosis. So with regards to hypovolemia, we have to ask whether there was confusion, dizziness, lethargy, and was there a reduction in the urine output. With regards to spontaneous bacterial peritonitis, we have to ask whether the patient had abdominal pain, fever, or any abdominal swelling as well. And also for thrombosis, we can ask whether the patient had shortness of breath, chest pain, calf pain, or abdominal pain. And afterwards, we can also ask what has been done up to now, and that wrap up the history of presenting complaint part in a patient who presents with nephrotic syndrome.